When congestive heart failure is first diagnosed, it's oftentimes relatively mild. People can oftentimes get excellent care in the community and lead fully productive and active lives. Sometimes a simple lifestyle modification like reducing fluids or reducing salt intake can make a huge difference. Simple medications like diuretics can oftentimes keep people stable for a long time, but unfortunately, congestive heart failure is one of those diseases that will progress over time. The disease can sometimes progress to the point where it may become difficult for people to get in to see the palliative care doctor or their community doctor anymore. And then we need to look at other ways of delivering care to patients. And here at Chapters, we have home health that we can offer patients as well. Home health is really intended to fill that void for people who can't, who are more or less homebound. It will become possible to provide physical therapy, occupational therapy to patients in their home care setting to help them regain strength and remain independent as long as possible. The home care team will continue to interface with the community physicians so that there's that active involvement and ongoing adjustment of medications and optimizing of all therapies, including oxygen or any other therapies that may be necessary. Early on, I talked about people who were functioning essentially normally and were able to continue to get their care through their community doctors. But once you get to the point where you are so limited that even sitting comfortably in a chair, you're not comfortable, you are experiencing shortness of breath or chest pain, these people probably could benefit from hospice services. We actually have home health aides, we have nurses, we have social workers, we have chaplains, and we have physician staff actually going and seeing the patients in their homes and providing all of that care in the environment. It makes it possible for them to avoid unwanted hospitalizations. The most important thing is to learn about the disease process, I think. Being educated as to what the problem is, what the fundamental mismatch is in congestive heart failure, will help people to understand what types of things are likely to destabilize the situation. You can, of course, obtain education from multiple resources. We have printed materials, but probably the best way to get educated is to really talk with the people that are coming to your home so that they can tell you from their own experience what this looks like now, what it's going to look like, and how to optimize your care.